Hello everyone. In this section we are going to see about antibiotic stewardship. I am Brinda Ronika, tutor working at M College of Nursing. Objectives: at the end of the class, students will be able to define antibiotic stewardship, discuss the purpose of antimicrobial stewardship program, enumerate 5R approaches in ASMP, describe core elements of ASMP, explain antimicrobial resistance and its prevention. So, antibiotic stewardship is an education program to improve the way how antibiotics are prescribed by physicians and used by patients. It is found out improving antibiotic prescription and use. So, definition. So, first, what is antibiotic? So, as you all know, it is a drug used to treat infections caused by bacteria and other microorganisms such as virus, bacteria, parasites, etc. So, next one is what is stewardship means. It is supervising or managing of something or the careful and responsible management of something. So now this is a definition of antibiotic stewardship. It is the effort to measure and improve how antibiotics are prescribed by clinicians and used by patients. So through that we can decreases the harm to the patient. So what is antibiotic stewardship program, or otherwise it is called as AMSP, antimicrobial stewardship program. So it is a use of right microbial agent for the right patient at the right time with a right dose, route and frequency, causing the least harm to the patient. Next, some of the purpose of AMSP. So to ensure better clinical implications and reduction of harmful effect to the patient, and another one purpose it is to make the antibiotic usage cost effective. So it reduces the cost effective, to maintain a quality in patient care, and to reduce of any collateral damage in case of multi-drug resistant due to microbial infections, and to prevent the generation and spread of antimicrobial resistant or antibiotic resistant. So these are all the purpose of antimicrobial stewardship program. Next we are going to see about 5R approaches in AMSP. So the first one is a responsibility. So what does responsibility means here? Everyone who uses antimicrobials acknowledges that use can cause harm. So when we do use an antimicrobial, we should take actions that reduce the risk for future public health. And the second R is reduction. So whenever we can, we need to look for ways to reduce our reliance on antimicrobials. So third R is refinement. That is, when we use antimicrobials, we should ensure that we are using the right drug at the right dose at the right time, treating the right patient for correct length of time. And the fourth one is replacement. So that is, consider non-antimicrobial products that could be used to promote good health and prevent disease. And the fifth R is, we should be critical of every antimicrobial was used and decide on a specific strategy for making further improvements and reductions in use. So these are all the 5 approaches in 5R approaches in antimicrobial stewardship program. So what are all they means? Responsibility, reduction, refinement, replacement and review. So next we are going to see about the strategies to implement AMSP. That are two strategies are there. One is a front end strategy and another one is a back end strategy. What is front end strategy means? This is also called formulary restriction or pre-prescription approach. Means certain antibiotics marked as reserve antibiotic require prior approval or prescribed only by an authorized clinicians. Example, colistin and fourth generation cephalosporins, etc. And next one is a back end strategy, and this is also called post prescription. So front end strategy, it is called as a pre prescription approach, and the back end strategy, that is called as a post prescription approach or prospective audit and feedback. This approach is based on reviewing prescription and advising clinicians to continue, adjust or modify or discontinue an antibiotic based on the culture sensitivity data. It is widely practiced and most effective strategy to implement AMSP. This approach also helps for de-escalation of antibiotic following empirical therapy. Next, we are going to see about 7 core elements of antibiotic stewardship program. So, in this first one is a leadership commitment. So, it includes the dedication of necessary human, financial and information technology resources. And second core element is accountability. A single leader must be appointed for noticing the program outcomes. And third one is a drug expertise, and a single pharmacist leader must be appointed to improve antibiotic use. And the fourth element is action. The recommended actions must be implemented. And the fifth one is tracking, which means the antibiotic prescription and antibiotic resistance must be tracked, monitored and recorded frequently. And the sixth core element is reporting must be done by the request persons to the doctor, nurses, staff regarding the antibiotic usage and resistance if any. And the seventh core element, it is a education. So the clinicians must be properly educated about the appropriate prescription and resistance of antibiotic. So these are all the 7 core elements in antimicrobial resistant program. What are all they means? Leadership commitment, accountability, drug expertise, action, tracking, reporting and education. Next, we are going to see about what is antimicrobial resistance, it causes, types and prevention strategies. So antimicrobial resistance is a development of resistance to an antimicrobial agent by the microorganism. So the microorganism, it includes bacteria, viruses, parasites. So antimicrobials, that is, you all know, it includes antibiotic, antivirals, antifungal and antiparasites or medicine used to treat infection in human. These things only called as antimicrobial. So what is the cause of antimicrobial resistance means? One is misuse or overuse of antimicrobial agents, like for viral fever, if the patient is taking antibiotic unnecessarily, means that is one of the cause. And poor infection and disease prevention control in healthcare facilities and forms, and poor access to quality affordable medicines, vaccines and diagnosis. The persons, if they are living if they can't able to afford the medical treatment, or if they can't able to access the perfect quality medical care setting, means that is one of the cause. And lack of awareness and knowledge, the illiterate people, they can use the drugs, and release of effluents from pharma industries into environment. So these are all the causes. Next we'll move into the types of resistance. There are 2 types of resistance it is there. One is a intrinsic resistance, another one is a acquired resistance. So intrinsic resistance means the natural ability of bacterium to resist a particular class of antibiotic due to its inbuilt structural or functional characteristics. So example, gram negative and positive bacteria, Pseudomonas species. Next, what is acquired resistance means? It is a development of resistance in bacteria that are initially susceptible to the antibiotic. It is the most common and dangerous form of drug resistance. So the examples includes spread of plasmids encoding beta lactamase genes. So these are all the two types of antimicrobial resistance. Next, mechanism of antimicrobial resistance. First one is what is happening means decreased cell wall permeability. Certain bacteria prevent entry of antibiotics into cell by altering the cell wall properties. Example, many gram-negative bacteria, and which leads to modifying the target sites. Modification of the drug target site within the bacteria cell makes the drug ineffective. So the common example is a MRSA, that is methicillin resistant staphylococcus aureus. So here the target site of penicillin, that is called as PBP, penicillin binding protein, is altered because of a gene on the chromosome called MECA gene. So these can alter the protein, and it can cause a ineffective to the drug. So which leads to the modifying the target site MRSA, which leads to efflux pumps. Means certain bacteria can expel the antibiotic as soon as it enter the cell by using expulsion pumps called efflux pumps. The example is a Escherichia coli, and which leads to enzyme inactivation. So certain bacterial produce enzymes that can inactivate and drug by leaving it. So several group of enzymes are produced by bacteria, that is example beta lactamases and the aminoglycoside. So this is a mechanism of the antimicrobial resistance. So here some of the antimicrobial resistant organisms are there. They are vancomycin resistant enterococci, methicillin resistant staphylococcus aureus, that is only MRSA, and gram negative bacilli, and multi drug resistant tuberculosis. So till now we have seen about the types, causes and mechanism of antimicrobial resistance. So now what we have to do? So what is the preventive measures of MDRO, multi-drug resistant organisms? So first we have to follow the standard precautions. It includes the very basic measures like use of PPE like gloves, gown, face mask, eye shield, etc. So that must be used appropriately in the healthcare setting. And second one is contact precautions. So wearing proper disposable gown and gloves when going to handle the patient with MDROs, and properly discarding them before visiting other patient. And next important thing, that is hand hygiene. 5 moments of hand hygiene, we should follow it. And next one is a cleaning and disinfection. Enhanced cleaning and disinfection of the hospital environment result in the reduction and control of the MRSA and MDRO outbreaks. Next one is a surveillance, that is a pediatric or routine inspection with healthcare facility must be done at the following 2 levels, that is patient surveillance and health worker surveillance. And next one is decolonization, that is nasal 2% mupirocin and chlorhexidine gel was, and systemic antibiotics can be used for decolonization of healthcare workers and colonized patient with or without symptoms. And the last one is antimicrobial usage restrictions, because the overusage of antibiotics must be avoided and its overuse must be monitored as far as possible by educating, updating and supervising the patient, families and the staff. Next, we'll see how to implement this AMSP. So the following are the key factors in the implementation of antimicrobial stewardship in healthcare settings. First one is the management support. So administrative support to allot money, personnel and other facilities. Second one is AMS team. Is a committee which is responsible for framing, implementing and monitoring the antimicrobial policy in the hospital. And The third one is a laboratory support for early detection of pathogens and reporting the antimicrobial susceptibility so that the treatment can be directed to use specific antibodies. And the fourth step is software support. So surely we need the technical support. The hospital computer network can use the hospital information system and laboratory information system. It helps in rapid dissemination of information regarding the emergence of drug resistance. And fifth step is antimicrotic policy. So availability of proper antibiotic policy in all the hospitals that can followed by the treating physician. So these are all the steps which is involved in the implementation of antimicrobial stewardship program: management support, antimicrobial stewardship team, laboratory support, software support, and antibiotic policy. So with the increase in use of antibiotics for the different indication, there is a threat of bacteria developing resistance to the antibodies, so that they will no longer be effective as for infections. Hence there is a rational use of antimicrobial agents. So as a nurse, we have to strictly follow that regulations to use the antimicrobial agents, because they are highly there is a higher chance for susceptibility. So this is about the antibiotic stewardship and its program. Thank you.